Our humanitarian arm here, Crossroads Relief and Development, has been supporting the fight against sky-high maternal mortality in East Africa for years. Joining me today from our partner ministry, Save the Mothers, is the new director for East Africa, Dr. MIRIAM MUTABAZI. Thank you so much for joining us.
Thank you for having me.
And congratulations.
Thank you.
On your new position. We're so excited to see what you're going to do. And you have a real passion for this. Tell me where that came from.
It came from my early days as a doctor. I used to work with the pediatric ward, and that was the era of HIV. And a lot of children came into my ward and they were just dying. And I realized many of them had lost their mothers and fathers. And I thought the onus was upon me really to fight for the lives of mothers especially. And so I developed an interest in obstetrics. And when I got into obstetrics, I worked for a long time in hospitals up country, and I saw a lot of complications, mothers dying in my hands. So I thought, oh, what's happening out there? And I decided that I needed to go out of the hospital in order to solve the problem. I couldn't just keep waiting for mothers to die in my arms at the hospital. So I started working in the communities, with the public, and that's how my passion for maternal and child health started.
And it's so heartbreaking because so many of these moms are dying for things that would be so inexpensive, a medication worth 99 cents, a suture, lack of sutures, just lack of electricity to operate on them, just things that we can fix. And I know that your organization, Save the Mothers, is part of that. Tell me, 6 months you've been doing this, what have you seen?
Well, what I've learned is we have many of our students who have graduated and they're out there, and we could harness their potential to support our mother-baby friendly hospital. And many of them are educators, politicians at different levels of care within the community, get the message out for behavior change, work at a higher level of advocacy for more funds, for equipment, for building capacity. And I'm excited because there's so much to work with, unlike when you're working alone and you're trying to save mothers. But there's a lot of potential out there who have gone through the Save the Mothers program that we can work with to build, to keep the momentum of reducing maternal mortality.
I think one of the things I always feel when I'm in the developing world and I see situations like this, you know, moms dying in your arms, small things that could fix. I saw a mom having a complicated birth. They needed to do a C-section and there were no sutures. And I said, when are the sutures going to come? Oh, 6 weeks. I'm thinking, how are you going to operate as a hospital without that, you know? And her mom was trying to buy cheap sutures. And I think about like the situation these moms are facing. Why do you need people in the West to care about this? Like us here in Canada.
Well, it's a global village now, and we need each other. And everybody has their relative advantage, comparative advantage. While we're on the ground, we don't even make sutures in Uganda. Maybe someday someone will come and help us make sutures. But before that day comes, we do need a helping hand to provide the sutures, to provide the medicines. We're in a place that doesn't make medicine. We make herbal medicines, but they don't work as fast as antibiotics. So we do need a helping hand. And
I know how alone it can feel when you see, you know, everything happening and you're trying to do it alone, and you're not alone. You have us with you. You have so many people around the world, and of course, like you said, the students. What is your dream for the future as you come into this role?
I see a stronger Save the Mothers, stronger in terms of a wider geographical scope beyond Uganda into East Africa, physically felt in Tanzania, Kenya, Southern Sudan, Eastern Congo, Rwanda, even Burundi. That's what I'd like to see with us physically, you know, not just in the 10 hospitals we have in Uganda and 1 in Tanzania, but I'd like to see our impact felt throughout the East African region.
You know, 100, 150 years ago, women in this country were in the same situation, and we changed it. We know it's possible, and so we are cheering you on and continue to want to help you. Thanks so much for all you're doing.
Thank you, too. We appreciate all the help you give us.
Awesome. Well, if you want to get involved and help this vital work continue, you can join us in the fight to save moms in East Africa. Give us a call, 1-800-265-3100. You can also give at our website, crossroads.ca/donate. We'll be right back.